Good afternoon, everyone. Madam Minister, thank you very much for this opportunity today. I want to say a big thank you to the Minister, to the Ministry of Health, and to the government of Uganda for its dedication to the global health security agenda and for hosting the upcoming meeting. Strengthening Uganda's health sector security is really a central focus of the U.S. partnership with Uganda. As the largest provider of health assistance to Uganda, the United States is committed to improving the health of all citizens so that they can live longer and more prosperous lives. Our initiatives aim to build Uganda's capacity to reduce the threats of infectious diseases like HIV, tuberculosis, and malaria, while simultaneously strengthening Uganda's health systems. For over 20 years, the U.S. Centers for Disease Control and Prevention, or CDC, has been working with the government of Uganda to address the country's health challenges. The U.S. government has contributed over $1 billion to the health of Ugandans and has provided technical assistance in many areas. Other U.S. government agencies, including USAID and the Departments of Defense, Treasury, and Agriculture, have also been playing a key supporting role, supporting national efforts to detect and respond to disease threats. This week's Global Health Security Agenda Ministerial Meeting is an opportunity for countries around the world to strengthen our joint commitment to working toward a world that is safe and secure from infectious disease threats. This is the core goal of the Global Health Security Agenda. A disease threat anywhere is a disease threat everywhere. In recent years, H1N1 influenza, Ebola, and Zika have all proved that outbreaks can start anywhere, spread rapidly across the globe, and have devastating results. I personally witnessed the tragic consequences of Ebola firsthand when I served as a U.S. ambassador to Liberia during the outbreak and the epidemic in West Africa. The threat of disease outbreak is not going to just go away. Just last week in Uganda, as we've heard from the minister, there's been an outbreak of the Marburg virus, which is a close relative of Ebola. And no single country alone can stop diseases like these. Preventing infectious diseases from spreading requires a dedicated global effort. We hear this repeatedly, that the world has gotten smaller, and disease is one way that has really shown us the rapidity with which it can spread around that much smaller world. We have to ensure that all countries can prevent, detect, respond to, and control disease outbreaks at the local level. Above all, the key focus needs to be on prevention, and it saves many more lives. We need to ensure that governments around the world make health security financing and funding a national priority. Under the Global Health Security Agenda, the United States assists 31 countries and has committed $1 billion for 17 at-risk countries, including Uganda, to strengthen their global health security. Over the first 4 years of the GHSA, we have made considerable progress, but we still have a lot more work to do. And we, as the U.S. government, strongly support extending the Global Health Security Agenda until 2024, so that together we can defeat infectious disease threats. The U.S. government is sending a rather robust delegation to participate in this week's ministerial conference. It will be led by retired Admiral Tim Ziemer, who is currently the Senior Director for Global Health Security and Biodefense at the National Security Council. And he's also accompanied by Dr. Brenda Fitzgerald, who is the new Director of the Centers for Disease Control and Prevention. And then a number of other U.S. government agencies and entities will also be participating in the delegation and in the conference. Thank you.